Hello, this is Dr. Seth Jarrell. Today I want to talk to you about diabetes. So what is diabetes? Well, there are two main types of diabetes. There's type 1 diabetes, which we normally see in children, and type 2 diabetes, which we normally see in adults. But both can be seen in both adults and in children. So what are the differences? Type 1 diabetes is a problem of the pancreas. The pancreas is no longer able to secrete the insulin that's needed for the body. This usually occurs secondary to some type of autoimmune attack of the pancreas. So when you normally eat sugar or any type of carbohydrates that are then broken down into sugar, the body needs to put that sugar somewhere, take it out of the bloodstream, put it somewhere else. And usually that's into your organs or your muscles. And so what happens in type 1 diabetes is you don't have the insulin, which causes that sugar to go into those organs or to that muscle. So the sugar stays around in the blood vessels. In type 2 diabetes, it's not a problem with the pancreas, at least not at first. It's a problem with the target organs or the muscles are unable to absorb the sugar like they used to. So you have insulin, and sometimes you actually have extra insulin to try to cause those receptors in the muscle to take up the glucose. So in both of them, it's a problem with the glucose inside the blood cells staying there. And that causes problems down the line. What causes type 2 diabetes? Well, type 2 diabetes most likely develops from a genetic component. So you inherit some part from your parents, but that's not the only factor and not the main factor. The main factor is insulin resistance from developing fat, especially fat in the abdominal region. We know that fats in those regions cause your muscles to become more insulin resistant. So the damage is done. We know that you have diabetes, the damage has been done, but we can stop the progression. And if we lose some weight, we can really cut back. So, what are the long-term effects of diabetes? Well, that sugar that is sitting inside of the blood vessels builds up. It builds this plaque-like substance within the blood vessels. That decreases blood flow, which can be harmful to different organs. Some of the main organs that we worry about diabetes affecting are, number one, the heart. So anybody with diabetes is at about a 7 to 8 times the risk of somebody who is a healthy individual at the same age of having a heart attack or a stroke. So those are some of the big things. Every time you're here for a checkup on your diabetes, you're going to hear me ask about, are you having chest pains? Are you having shortness of breath? Are you having swelling in your legs? If you're having weakness of your arms, weakness of one of your legs, numbness of your arm or one of your legs, or problems with speaking, those can be signs of a stroke, and I want you to go to the hospital immediately. Some of the other things that diabetes can affect, if we start from the top, is your eyes. So we encourage that you get an eye exam yearly. They look at the blood vessels at the back of the eye to be able to tell if you are having effects on your eyes from the diabetes. Next, as we go down, we talked about the brain. Next is the heart. We talked about that. Next is the kidneys. So the kidneys can be affected because there's blood vessels running to the kidneys. And so what we do is yearly we check the amount of protein, also known as a microalbumin, in your urine. That's a marker for if any damage is being done to the kidneys. We also look at some blood tests as well. If there is protein in the urine, we start a specific blood pressure medication to help protect the kidneys. And that can be even if you don't have high blood pressure. After the kidneys, we think about the feet. So the feet are affected because you have very small blood vessels running to the nerves in the feet and in the hands as well. As those blood vessels get clogged up, they can cause the nerves not to function as well. So you get the numbness and tingling in the hands and the feet. The numbness and tingling isn't as worrisome as when we completely lose sensation, and then you may not notice that you get a sore. And so I ask my patients to check their feet every day after they get a shower or during the bath for sores on the bottom of their feet and in between the toes. If you see those, I want to see you in the office as soon as we can get you in. Diabetes also puts a person at increased risk for infections. That means that your immune system doesn't work near as well as someone who does not have diabetes. So you're going to be more prone to getting pneumonias, sinus infections, any kind of virus. So we really promote that you get your vaccinations. That includes your tetanus vaccination, your pertussis vaccination, your pneumonia vaccinations, which there are more than one, your flu vaccinations, and then up to date on all your other regular vaccinations. So now that we have a diagnosis of diabetes, what do we do about it? Well, the main lab that we follow is something called a hemoglobin A1C. Hemoglobin A1C is a marker over 3 months of what your glucose is normally running. Hemoglobin A1Cs run anywhere from 0 up to 18 or 19, but normal values are anything less than 5.7. Anything from 4 to 5.7 is a good value. From 5.7 to 6.4 is pre-diabetes, and anything 6.5 and above is considered diabetes. So where do we want to get you on that scale? Anytime I have someone with diabetes, I usually try to push them to a hemoglobin A1C of less than 7. 7 is our goal. So that every time that you're in here for a diabetes checkup, that's going to be one of the main things that we're looking at. Is your A1C less than 7? Now, we also can check sugars at home. Checking those sugars at home should first be done on fasting blood sugars. So that means you haven't eaten anything that morning and you checked it and we see what your blood sugar is. You'll have a glucose monitor that you do that with. Hopefully we're less than 140. Some people I like to push less than 120. After you eat, your blood sugars are going to go up. Our goal is usually less than 180. Some people less than 140. But as long as we're less than an A1C of 7, we can decrease the risk of those things that we mentioned before. Those blood vessels clogging up with the sugars and causing damage to the organs, such as the eyes, the brain, the heart, the kidneys, the feet, the hands. That keeps us from getting those problems near as much. So the medications that we take, we always start with metformin. That is the number one medication that is approved for diabetes. Some people don't tolerate metformin. It can cause some diarrhea. We have to try the extended release first. And then some people don't tolerate it at all. But it is the best medicine that we have for diabetes. After that, there's many other types of medications. There are other oral medications, and then there are other injectable medications that are not insulin. Finally, there are some who require insulin. In all type 1 diabetics, you require insulin because you're not making it. The oral medications are not going to help you. In type 2 people, if your A1C is very high, the oral medications that we give you are just not going to work, and you're going to need insulin to bring it down. Sometimes we add the oral medications onto that, but if it's very high, we sometimes cannot get it controlled. And as your diabetes progresses, if it's not controlled, and you develop more insulin resistance or the muscles aren't taking up that glucose, eventually the pancreas is working harder and harder, and sometimes it doesn't produce the insulin like it needs, and we have to do insulin in that case as well. The most important part of your diabetes treatment is your dedication to treating your diabetes. So, first of all, let's talk about diet. So a diet with a high glycemic index, that is a bad diet for you. What does that mean? A high glycemic index is a diet that when you eat, it causes your sugars to shoot up very high. So a diet high in sugars, so in those simple sugars like sweets, a diet high in simple carbohydrates, not the complex carbohydrates, a diet that is low in protein. So the big things I like to tell people are, number one, I want you to take a course. There's some free courses given by a couple of the hospitals here in town, by some really good diabetes educators that talk about how and what you're going to eat from now on. It's also important to eat little snacks, not to eat a whole lot at one time. If you eat a whole lot at one time, that shoots your sugar up. So good amounts of fats, good amounts of proteins, complex carbohydrates, very important. The second thing is cutting your calories overall. We have to lose weight, and I encourage you to watch my video on weight loss. But if you lose weight, we decrease your insulin resistance, and that overall will make your diabetes much well controlled, much better controlled, and it will, in some people, cause you to go in remission of your diabetes and maybe become a pre-diabetic or even no longer diabetic at all. The second thing is exercise. Exercise is extremely important, both cardiovascular and weight training. So cardiovascular is important because we know that if you do cardiovascular exercise, insulin resistance goes down, and you can also lose weight that way. So 30 minutes of exercise 5 days a week, or 150 minutes a week of intense activities. So it is important that you do more than what you just do at work or what you do around the house. This is extra. This is before work, during your lunch break, after work. When you're doing something to get your heart rate up to at least 130 and possibly to the 140s range. So getting out jogging, getting out walking, even a brisk walk where we eventually progress to a jog, or we bicycle, we swim, or we canoe, something to get that heart rate up. That's cardiovascular exercise. The second thing is weight training. If you build more muscle, then we know that that's more muscle to take up the glucose that you need, that you have within your blood vessels. So getting into a gym is extremely important, or having a home gym. If you've never been trained how to work out, that's important as well. So getting a trainer for a little while, or having somebody else who works out on a regular basis teach you how to work out, to build up some core muscles, some abdominal muscles, some shoulder muscles, some pectoral muscles, some gluteus muscles, some of the big muscles in your body, so that you can then become less insulin resistant. So what now? The first thing is getting you very dedicated to your diabetes treatment. So that means extreme exercise, very dedicated diet, and then getting you involved in that course we talked about where they teach you the different diets and ways to look for side effects of your diabetes. The second thing is getting that A1C controlled. So we may or may not be starting some diabetes medications today to get that A1C less than 7. Remember, 7 is the magic number to decrease those side effects of diabetes. The third thing is getting you up to date on all your vaccinations. So making sure we get the vaccinations for the flu and for the pneumonia vaccine, for your tetanus, all of those. And some of these things may take more than one vaccination, so it's going to take a little bit of time. And the fourth thing is we just trust. We trust that this is going to get controlled. And we're going to go through this together. If you have any questions, please feel free to call us. We'll be happy to get you in for an appointment, or there may be some things we can answer over the phone. But we're going to go through this one step at a time and get you where you need to be. Thank you, and have a great day.